think there are a number of reasons patients don't, or our referring physicians don't use transplant as much for MDS. Age is certainly one of the things. I think people have the misperception that older patients can't make it through transplant easily, and I'll show data tonight showing that really they can do just as well as younger patients. I think the other perception is that we can't find donors for our patients. Now we have new donors available for our patients that really allows us to find donors for almost everybody who needs a transplant. So that has changed the ability to do transplants in many patients that we couldn't transplant before, because we have new ways to find donors for them that are very effective, and they can be transplanted with equal efficacy as if they had a brother or sister as a donor. One of the problems with MDS is that it's the age of older patients. So older patients acquire all the comorbidities we all do as we age. They have heart problems, lung problems, kidney problems, but even in certain patient populations, even with those, we can get them through a transplant. So the outcome looks very promising for patients with transplant. Data from the CIBMTR, our registry data, shows that patients are alive at 6 years. 50 to 60% of patients who go through transplant can be alive at 6 years without evidence of disease. So there's a very high cure rate, we think, and the cure rate has to be compared to the cure rate without transplant, which is really 0. So patients can live a long time, they can be free of the disease, and can be free of a lot of the complications of the transplant as well. Certainly we can use related donor transplants, we could use unrelated donor transplants, and we could use haploidentical transplants now. And they both all give about the same outcome. Usually patients the disease-free survival is in the 30 to 40 to 50% range in some of our studies at the 4, 5, and 6 year mark.